Dear friends, how are you? I'm Mark Golub. Always wonderful to be with you. And I hope you're each doing as well as possible during this coronavirus pandemic. And I received some lovely emails after our program last night featuring Abby Goldfarb and her parody Mask Maker. And Ken Fellenbaum, thank you for your most kind words. And Herman Pasternak asked a question that made me smile. Why not in Israel? Yes, Herman. Why isn't JBS on television in Israel? Though JBS is available in Israel live on the JBS website. But I do believe it would be wonderful if Israelis and English-speaking Olim who've made Aliyah to Israel had a chance to watch JBS, that Israelis could see the way in which American Jewish pluralism works in the United States and see how very much a large percentage of us, of American Jewry, cares deeply and loves the state of Israel and the people of Israel. So we do have a dream that one day we will have the money necessary to put JBS on Israeli television. So the entire focus of our lives these days is, of course, the issues surrounding the coronavirus. How do we really stay safe from the virus? What do we really know about the way it's transmitted from one person to another? How long does it live on various types of surfaces? Are there any medications on the horizon which people with the virus can take to mitigate its effects, prevent death? And for that matter, when might we have a vaccine for the coronavirus? And all of these questions lead to one overarching question. When can Americans begin to leave their homes again and re-enter society and restart the economy? There are some who fear that life as we knew it before the coronavirus may never be seen again. Is that a real possibility? Or is that an exaggerated fear? Well, for some answers, I am so happy to have with us on this edition of Gam Yachad, Together During COVID-19, Dr. Howard Werman, Professor of Clinical Emergency Medicine at the College of Medicine at Ohio State University, and he's an attending physician at both the Ohio State University Wexner Medical Center and at Ohio State East Hospital. Howard, thank you so much for joining us on JBS.
Thanks for having me.
So, Howard, before we talk about various aspects of the coronavirus, can you give us a sense of where you are in the Jewish world? What is your own Jewish background?
My own background is I grew up in Syosset, New York. My parents were actually, they moved out there when Long Island was really not very developed in the early 1950s, basically. I was born on South Oyster Bay Road out there, and my parents were actually forming members. They were founding members of Midway Jewish Center out in suburban Long Island, obviously. So I grew up, we had I think my parents were both very connected to the synagogue, but my mother in particular became involved first in sisterhood, and she ultimately became president of the sisterhood. I think at one point, both of them served on the board of directors of Midway Jewish Center. Now, ultimately, my mother became the first female president of the shul.
Very nice.
And then at a time when obviously women were gaining more of a role in the synagogue itself.
Right.
She was probably the first female called for an aliyah on the bima, and I can remember that very distinctly. Her friend and colleague Ezra Finkelstein was the rabbi at the time, His father obviously was the whatever the at the Jewish Theological Seminary. I forget his leadership position there. The chancellor, I guess it was called. Anyways, make long story short, she was called up and it was a very controversial time. Ultimately, my mother became very interested in Jewish life, and she actually enrolled, first just taking classes at the Jewish Theological Seminary, and ultimately committed to getting her a rabbinate, which she did. She was ordained as a rabbi.
Wow.
At the age of 63 years.
Mazal, good for her. Yashikoach. Yeah. You're the adult son of an adult mother rabbi.
Right, exactly.
Do you have children?
What's that?
Do you have children?
I have 4 children. Yes, I do.
So their grandmother is a rabbi.
Yeah, and I think they were always aware of that and very proud of that fact.
Well, they have every reason to be proud. You have reason to be proud.
Yeah.
So, Howard, how did you end up in Ohio?
Basically, how I ended up in Ohio, I went to medical school in Buffalo, New York. At the time, in the early 1980s, there really wasn't much emergency medicine in New York. It was usually part of either surgery or internal medicine. But programs were springing up in Ohio. Interestingly enough, some of the oldest programs in the country were in Akron, Ohio. Actually, the oldest was in Cincinnati, but in 1971 was Cincinnati. 73, there was a program in Akron, and actually by the mid-70s, there were 2 programs there. As fate would have it, my mother was from Akron, Ohio. And so I went to stay with my grandparents and do a rotation in emergency medicine. I heard at the time there was a program starting at Ohio State. My roots at Ohio State, my grandfather graduated OSU in 1926. So I always had Ohio State in my blood. I went down for an interview. I met a fellow named Douglas Rund, who was literally the chairman, and they were going to start a new program down there. He and I must have hit it off because I matched there and went there in 81, and I've been there ever since. So I'm coming upon my 40th year at Ohio State.
Mazel tov to you. That's a wonderful story.
Thank you.
So, Howard, you are intimately involved in the medical crisis posed by the coronavirus, especially as one involved in emergency medicine.
Yeah.
And you're also the medical you're the medical director of MedFlight of Ohio,
Right.
which
Yes.
transports the critically ill to larger hospital facilities in the state.
Correct.
So I have a number of questions for you, some
Sure.
of which you may simply not have answers for. And as far as I'm concerned, you're saying to me, the answer is I don't know, or we don't know.
Yes.
Is an absolutely legitimate answer, and it helps us understand where we are. But you have some intimate knowledge of the disease because you were infected yourself. Can you tell us about that?
Sure. I wish I could tell you how I became infected with it, and I am, I guess, pleased to say it was not an occupational injury or illness, basically. I know that for a fact. I had an unfortunate situation. We were talking about my mother. My mother became ill in late February, early March, and so I was traveling back and forth to Florida, and ultimately she passed away, and we had to fly up to New York for the funeral. So somewhere in transit and either on airplanes in the hospital down in Florida up to New York, somewhere along the way I must have contacted the virus. I'm told one of the interesting things, which isn't mentioned a lot, is that there may be sort of a dose response curve for this virus, meaning if you get exposed to a little, somebody with mild symptoms or asymptomatic, you may get a mild case yourself. If you're exposed to a large dose, you may come down with a severe infection. It's, that's one of the things that they postulate or have been postulated. anyways, make a long story short, when I got back to New York, we had actually had a Shiva minion at my house on Tuesday night after the funeral. And shortly after that, I came down with a cold, little bit of feeling run down, had some aches, and maybe at some point developed sore throat and a little bit of a cough. That was the extent of my symptoms. They went on for about 5 days, and as the weekend was approaching, I realized the next week I was supposed to be back at work. And as fate would have it, I actually had the flu, a relatively early case of the flu this year. And so I decided that since I had actually worked a couple days with the flu in the emergency department, that I wasn't going to do that again. So I at least felt it was my obligation to mention it to my chairman and say, I had this illness before. I'm feeling symptoms now. I know that COVID is something that people are talking about. Should I take a test? Should I, so the long and short of it is I actually went through 2 tests before they were able to get a result for me and allow me to at least know what my status was. And lo and behold, on March 20th, I got a definitive diagnosis of COVID. And I know that, without getting into too much detail, later on I was one of the few people who has actually been tested for antibody titers. And I do, in fact, have antibody titers to the COVID virus.
All right, this whole thing is fascinating. I want to make sure I have it straight.
Yes.
Your mother passed away in which month?
She passed away March 7th. The funeral was March 9th in New York. So we flew from Florida to New York.
Okay. By March, the nation really knew they were in battle with coronavirus, correct?
Yeah, I think at the early March, it was in Washington. It was starting to spring up in New York. But it was not, in early March, I think they knew that this was going to spread nationwide. But I don't think at that time it was, it was just beginning to be realized that it was very transmissible and the potential for a pandemic was clearly recognized.
Okay. I want you to, you said, interesting enough, you're not sure how you got it, but you describe the situation where you're going down to Florida, you're coming back by plane. Although you don't know the answer directly, the question I'm asking you reflects a question so many of our viewers have and people have throughout the country. It's about how one contracts it. Now, do you imagine that you in some way touched something that had the virus on it, and that you then in some way, unconsciously, inadvertently, put your hand in either your mouth, your nose, or your eyes, and in some way it then got into your respiratory system? Is that what you imagine happened to you?
Yes, I have to imagine that. I don't believe, although, again, the stops along the way, I was in an intensive care unit down in Florida, and there were people on, even my mother was on BiPAP, which is an aerosol generating. Other patients were on that as well. But I don't specifically recall. And I guess the other piece of it is I spent a lot of time, my sister was with me, and she's never had symptoms.
Interesting. She did not contract the virus in one way or another from you.
That is true.
Even though she was with you.
Correct.
Even though she was with you at Shiva.
Yeah, she was, well, not the Shiva in Columbus, but the Shiva in New York for sure, and the funeral, yes.
Fascinating. Did she fly with you?
She did fly with me, yes.
So you're
well, I should say she flew with me from Florida to New York.
Yes.
Florida to Columbus to Florida, and Florida to Columbus, back and forth, not. But before then, yes.
And at what point in this journey do you begin to feel ill? Is it before you return to Columbus, or while you're still in New York
No,
attending
it
to
was
your mother.
after I returned to Columbus. It was that night of the Shiva Minyan, which, by the way, meant that I had to at least tell about 25, 30 people that I came down, I was, COVID positive.
Yes.
So, yes, it was an interesting time.
Okay. In general, Howard, we hear that this virus is not airborne, and airborne is a technical term within your medical world.
Right.
There are some viruses which are airborne, and that means that they remain in the air and that somebody walking through an air that's been infected can actually breathe in the virus and have a problem. Mm-hmm. We understand that the coronavirus, the way it's told is that if you stay 6 feet or more away from another human being, even if that human being is infected, mm-hmm. any kind of droplets that might come out of a person's mouth or nose are not going to travel the distance necessary to reach you, if you're staying 6 feet away. And I want to know from you, and you have had all kinds of experience. You're dealing with patients all the time.
Correct.
Do you think that is an accurate depiction of how this disease is not transmitted? Do you believe 6 feet or more away from a person who even has the disease protects a person without the virus from getting it?
For the most part, I would say the answer is yes. Now, they have done some, again, the caveat to that would be if somebody coughs violently or sneezes, they can, in theory, project that virus. But I think they have measured that distance that it's propelled somewhat less than 6 feet for the most part.
Okay, but my own reaction to that is, if I'm standing with somebody who sneezes or coughs violently, I am going to make sure the first thing I do is move away, and the next thing to do, wash everything about me and not put my hands or my fingers in my mouth, nose, and eyes. I'm smart enough to know if somebody I'm with coughs or sneezes violently, even at all, by the way, at all, I'm out of there. We're talking about normal circumstance where you're with people who are just on a plane with you or at a shiva with you or in a hospital with you, and you're trying to stay away, but lo and behold, this person is not coughing or sneezing, and yet they have the disease. And I'm saying to myself, if you're on a plane with someone and you're sitting next to that person, and that person never sneezes on you and never coughs on you, and when you get off the plane, the first thing you do is you walk into a men's room and you wash your hands with soap for no less than 20 seconds, singing happy birthday over and over and over in different keys. Fine. The chances of your getting the disease is relatively small, if not zero. Am I saying it correctly in your mind or not?
Well, I guess, again, it depends on the proximity because, if you're literally in close contact, and so if you're literally on the plane with them and you're just having even normal conversation within a foot of each other, there is the potential to transmit under those circumstances.
Via just the respiratory system.
Yeah, can project it a few centimeters. They've measured that for sure.
And then you breathe it in, I assume.
Yes. So it can be transmitted that way. Droplets, things like that.
Okay. So you're telling us, however, if you're 6 feet or more away from someone and you take the proper precautions.
Yes.
There's a very good, an overwhelming likelihood that you will not contract the disease.
Yes.
And so, one of the things that I'm sensitive to is the extent to which my audience, and the audience is of all ages, but there's a large preponderance of people who are in the demographic 60 and older, and they have to worry, and many of them are alone in their homes and they worry. There is this feeling, Howard. We've seen stories written that people think it's in their hair and it's seeping under the door and it's coming over the lintel and it's everywhere, and so people are frightened. And one of the things they should hear you say is that if people take the proper precautions, there's no need to feel that the virus is hunting them down and that they are in real danger. Am I saying it correctly?
I think you are most correct that way, yes. I mean, this isn't something, the virus doesn't creep under closed doors. It doesn't, I think just taking proper precautions, even if somebody delivers something to your home, you can obviously take that in. You wash your hands after you've done that. Just, the simple things that, frankly, a lot of our infection control folks have been talking about for years. So there is no reason, that if you take normal precautions, and I've seen people doing things like sitting outside in chairs, with distance, visiting with their neighbors and stuff. There's no reason to fear that they're going to get the virus under those circumstances.
Okay, you say it very well. By the way, what about masks in your mind? And the reason why that's an important question is because for a long time, we were told by the CDC, we were told by the administration. When I say the administration, I don't mean Donald Trump. Right, I'm talking about, we were told by the people who were giving all of us advice and information. They were all saying, not only do you not need to wear a mask, it's counterproductive to wear a mask. That seems to now have a 180 on masks. Yes. Where do you stand on the issue of a person is going out to the store, wherever, should we wear masks?
I think, again, the answer is going to be what kind of... Now, first, a couple things about the mask. And again, I don't think this has changed. I think most of the masks that we're talking about are really still designed to protect you. They're protecting you as a potential asymptomatic carrier to giving it to somebody else. It's not, you are not necessarily protecting yourself. If you're going to do that, really you need to wear an N95 mask, the specialized mask that, that prevents the particles from coming in. But again, I think in situations where you're going to be, if you have to go to a grocery store, you've got to go to a pharmacy, and you can't necessarily guarantee social distancing. And you potentially, now, to be honest, here's a perfect example. I know I have antibodies. So in theory, I can't transmit to anybody else, but most other people have not been tested, don't know if they've been exposed. Their estimates that up to 25% of people have asymptomatic disease. And we know that there's a group of people, a significant group that have, minor symptoms. So it's really to protect others, again, for that very situation where you might be standing next to somebody and you would be transmitting it to somebody else as opposed to protecting yourself.
All right, I want to push you, though, just one more moment. I'm walking into a grocery store.
Yes.
And I'm going to be across from a cashier. Mm-hmm. Are you telling me that a mask that I wear is not protecting me in the off chance that cashier has the virus?
Boy, I mean, I guess that if she sneezed or he sneezed or whatever, that would be protective. But, again, though the most surgical masks and homemade masks are not going to filter out the small particles under those circumstances. But, I don't know that it's going to be protective. Now, again, other countries may feel differently. Obviously, you see the South Koreans wearing masks all the time.
No, we are now being told to wear
Yes.
masks.
Yes, that's
And
true.
you're saying the only reason really is to protect somebody else should we have the virus and not know it.
Right. I think that is the majority thinking on that point.
Howard, I have only a million more questions to ask you,
That's fine.
but we have to pause for a moment, and I'm so appreciative, again, of your
No
taking
problem.
time to be with us on JBS. Thank you very, very much. Dr. Howard Werman, and we'll have more with the doctor on an upcoming edition of Gam Yachad, Together During COVID-19. So let's look at the rough coronavirus numbers for April 23rd. Here in the United States, there are about 875,000 diagnosed cases of the virus, with a recovery rate now of 9% over 85,000 people, while the mortality rate is slightly under 50,000, which represents 5.6%. In Israel, the number of diagnosed cases is just under 15,000, with the recovery rate rising to 38% and the mortality rate remaining at just 1%. My reminder that if there is someone you'd like mentioned for a Mazel Tov on a Simcha or in a Misha Berach list mentioning those who are ill and for whom you hope there is refuah shlema, complete healing, or if you have a Yortzeit name and no synagogue setting in which it could be read, please send me your names and I will be privileged to read them here on JBS. Any information may be sent to jbscommunity@jbstv.org. And if you wish to be in touch with me directly, you can email me at rabbigolub@jbstv.org. I always love hearing from you. My thanks as always to our director, Sloan Copeland. And until the next time, I'm Mark Golub. Stay safe and be well, my friends.